Good morning, Pat Ziemer here with MagnaWave. Thank you for joining me this morning for this edition of the MagnaWave Office Hours. We come to you on Tuesday mornings to answer any questions you may have about PEMF therapy in general, whether it's machines, training, protocols, guidelines, whatever your questions may be about PEMF therapy. We're here to try to answer your questions and get you the information that you need in order to make good, valued decisions with regard to your health and wellness and how this particular therapy may be of assistance to you. If you'd like to talk with me, send me a text to 502-599-9722 and I will call you back and we can have a conversation or talk about anything that you'd like to talk about. I like to do that because quite often when we have those types of interactions, we go deeper into the question. If I answer a question, I'll provide the answer that I have on my mind at that particular time, but if I'm conversing with you, a lot of times we can go deeper into the particular question that you want to ask, and that helps everybody learn a little more. If you're on CastBox with us this morning, and you can listen to us on CastBox, the link will be in the chat area. It is in the chat area, Chris tells me, so you can listen to us on CastBox as well. If you'd like to talk to us on CastBox, just do the phone in and I'll put you online here and we can visit the same way as well via CastBox. You can ask a question on Facebook and on YouTube. So however you're viewing us or listening to us today, we want to be able to answer your questions and talk with you whatever that situation may be. Let me look and take a look here and see if there are any questions at this point. Good morning, Maureen. Felicia's with us. Barbara Anderson Van Loo is with us. Janet's with us. Hazel Smith is good morning. And Grand Performance Solutions. Good morning to everybody. Thanks for being here this morning. I want to give you a little recap of some things that have been going on. 2 weeks ago, I had an opportunity to be with Jack Canfield. Debbie and I went to Atlanta to meet and partake in a seminar with Jack Canfield, the Chicken Soup for the Soul guy, talking about how he works with businesses and people to improve their life and their success and so forth. And we really enjoyed that particular time together. And I've taken some classes through Jack's business to be able to share with you some of his philosophies about business growth and development. I'm also going to write a chapter. Don't know that it's going to be in the book, but I'm going to submit a chapter to him for consideration in his most recent book that he's compiling, dealing with success in everyday life and in business. So I'm excited about trying to accomplish that. But that's was a good time we had with Jack Canfield. And he's using a machine. He purchased a machine after we visited him in California last month. He's liking it very much. It's helping his knee and his back, so we're excited about that. And I think some of his employees are using the device as well. Also, just this last week, started last Wednesday, was the Retired Racehorse project at the Kentucky Horse Park in Lexington. It was a tremendous event, about 500 repurposed thoroughbreds off the racetrack were there. What they do is they have a year to train these horses in various disciplines, everything from Western to hunter jumper to eventing, whatever it may be. That someone's interest is, they take a retired racehorse and repurpose it, retrain it for a new discipline, and basically a second career. And it was really fun to watch these people, to see how well they brought these horses along. We're also very excited that Rosie Napravnik, an associate of ours and someone that we sponsor, as you know, Rosie is one of the most successful female jockeys of all time. And she's now repurposed her career to help repurpose and retrain retired thoroughbreds. And Rosie won the Retired Racehorse Project classification or discipline in eventing, overall winner. And she came in, I believe, second in the overall competition for the most wanted horse in the country. In this particular type of competition. So Rosie did really well. We're excited for her, and we're excited for what she's doing with the Retired Racehorse Project. So that was a lot of fun. If you want to know more about that, there's stuff on the Facebook page and articles about Rosie.
Her winning horse, Sanimo, we have the video of the treatment with it.
Oh yeah, we also, the winning horse, Mo as she calls it, or Sanimo, We did a live hands-on training at the event with the horse, and so it was kind of fun to treat the horse and talk about situations going on and how the horse appreciated the treatment, and it was obvious that the horse was enjoying the treatment. That's on the Facebook page. If you'd like to watch that, you can certainly do that. So again, we'll move on to see if we do have a question here this morning. I have a client who gets deep tissue massages and wants to know when she should have a MagnaWave session. Same day, before the massage, or after the massage? Well, that's pretty much up to the client. And what I would say is, well, whatever they want. It doesn't hurt to do it before. Or it doesn't hurt to do it the day of. It might, sometimes when people get deep tissue massages, they are sore because there's so much pressure exerted in the deep tissue or to the deep tissue that sometimes someone is a little bit sore after a deep tissue massage. So maybe after the massage would help relieve some of the soreness that they feel after the massage and then help them progress down the road. We can really provide the benefits of a deep tissue massage without the related soreness that so often comes with deep tissue massage. So, but I understand while our process is very relaxing, someone who enjoys being rubbed or having hands on would certainly enjoy a massage and then use the MagnaWave after potentially to help them stay fit, stay feeling well as they would with a massage. So really it's totally up to the individual preference of the person receiving the deep tissue massage. Probably the thing to do is have the massage and then the following week follow up with the MagnaWave treatment to keep everything again in place as your client would like to have it. So that's the question there with deep tissue. Good morning, Sandy. Let's see. Pat, wish I could stay to chat, but I'm running to see clients. Okay. Could you speak a bit about what is the best practice is when working on horses at competitions who may not have had MagnaWave before? I'm working 2 very large horse shows coming up, and I'm sure I'll have some folks wanting to try it who haven't used it, MagnaWave, prior to the show. Okay, that's a great question. And about the best practice on horses in competition. What you want to be cognizant of is if a horse has never been treated before, it's nothing that's going to make the horse jittery or anything like that. But in a competitive state, each animal is different. So what I would recommend that someone would do if they're competing this afternoon, and they want to treat the horse this morning, I probably wouldn't do that. Why? Because each horse responds differently. So you may take a horse, treat it this morning, and when it goes to the competition this afternoon, may be so relaxed that it really doesn't want to compete today. Now tomorrow it may be fantastic because it's had a chance to absorb the treatment, let it work and do its job, and then go compete. On the other hand, I've had many treatments to where I treat the horse and then the horse goes to work or goes to competition and does fantastic. However, you don't want to treat a horse that takes the edge off when somebody wants an edge on the horse. So that's the way you need to think about it. What I always recommend, if it's new, that you treat the horse, they go work the horse, and then they see, oh boy, the horse was fantastic. Or you know what, the horse was better the next day. And because, again, it gets into the system and works through and allows the horse to better optimize what they're the sessions that they're receiving. Now, for years, I would treat horses and they would improve immediately. They would handle more easily. Their range of motion would be improved. The whole benefit, they would change leads more effectively, or when they were asked to change leads with no resistance. So typically to treat an animal and see an improvement right away is normal. But in a competitive situation, you want to make sure that the animal is at its best pace for the competition that they're going. I hope that's clear in what I'm trying to say. Does that make sense? Did I say that all right? I did. Sometimes it just got to work through it. But certainly, if they're competing tomorrow and you want to treat them today, perfect. You can't hardly go wrong a day out or 10 hours out before a competition. Just you want to make sure you handle yourself properly so the customer gets the maximum benefit of what you're providing them with the PEMF treatment. Okay, we're not seeing anything on our side. What issues are you having?
She's good.
She's good?
She's good.
We're good. Okay, great. They have it now. I see that. All right, if you have a question, please feel free to post it on Facebook or YouTube, and it'll pop up here, and I'll be able to approach it for you. Or if you'd like to talk with me, send me a text to 502-599-9722, and I will call you back, and we can have a conversation. Practitioner writes, her horse had a bad kick and ruptured a peripheral vein in the knee, above the knee, and required 2 layers of stitching to suture. There is a drain in and a pressure bandage applied. My vet thinks that by Thursday we can take the pressure bandage off. I realize I don't want to increase blood flow at this time. Let me stop there. To treat would not increase blood flow, but would improve the blood flow. However, if there is a drain and for bleeding and for fluids, you don't want to necessarily be treating because you want that drain that pressure bandage to do its job, close off the wound. So it is correct. You don't want to certainly treat around the wound. But the question is, at what point would you think a full body or calming protocol would be in order to help this 4-year-old off the track thoroughbred so we can optimize healing? If you wanted to do the calming procedure from the head down the neck on the top line and do that, let's say in 5 minutes, you're not going to change the overall situation of the horse. You can calm the horse, you can relax the horse, allow it to be in a better, less stressful position for the healing. I think you'd be fine with that right away. As long as everything else is in control. Again, you would not want to treat the area of the injury, and you would not want to do a prolonged treatment on the horse to get everything going. You want to let the vet's correct, let the horse rest for a few days, let's take the pressure bandage off and go from there. But if you want to calm the horse, if there's a lot of stress, you could do that. Sometimes what folks will do is treat the aspirin point on the back of the hock to just basically like be giving the horse a natural aspirin. So treat that area just for 5 or 10 minutes just to calm the animal. They like when you treat their legs. Now this injury is on a leg, so if you were going to calm the horse, you might treat the other leg just for 5 or 10 minutes, and it's just a soothing aspect that's provided with the treatment at that point. So certainly wait for a full treatment until the pressure bandage is off and everything's closed up properly, and then after a few days you can certainly start treating the wound itself for a good healing aspect that this allows to provide to the animal to better heal itself. Great question, and I hope everything goes well. Let's see here. Tina asks a question. I know you cannot treat a pregnant horse, MagnaWave a pregnant horse, but would a back on track sheet be used? Sure, you're not doing anything with a back on track or some comforting blanket to use on the horse to help it maybe feel a little better and to potentially relieve some back stress and that type of thing. There are doctors who are horses having foot problems or leg problems. What we don't want to do with regard to a pregnant mare is do anything around the fetus, if you will, or the foal, if you will, in development. You want to just stay away from that area. But if you need to treat the feet to eliminate some stress and to help them feel better, certainly doctors will allow that from time to time. Or shoulders, if they're having weight problems or the pain in their shoulders, you could do that. But stay away from the area of the fetus. Great question, though. Let's see here. If a person is waiting for a liver transplant, what protocol would be used? Certainly you want to talk with the doctor and explain to them if they have questions about what you're doing. If the person is in pain or stress and you want to treat their upper back and their shoulders just to help them relax and feel better, the PEMF has a very calming effect and in that regard. And so to treat that area, I certainly, again, would always check with the doctor to make sure so they understand what you're doing and what you're treating in order to help this person feel better. So the protocol would be treat the feet, reflexology type of situation, put the coil down, put their feet on the coil, again to provide relaxation and some nominal pain relief that they may be experiencing at that point. So you could treat the shoulders and the neck, if you will, or the feet in order to provide some comfort for the person. But again, always be sure and check with the doctor as to what you're doing so you're on the same page. Has anyone had treatment success with trigeminal neuralgia, which is a nerve in the face and head? And typically, if you brush your teeth with that type of situation, you can provide a lot of pain because the nerve becomes irritated. Can you treat that? Sure. Very low. You'd hold the coil up to the face and you would want to try. You don't want to do something that causes the person to have additional discomfort because of the nerve condition that they're having. So certainly I would, again, put the coil up like, over the face like this, very low type of setting, and just see how they feel, how it works. If it stimulates some activity that they're not comfortable with, then you have to wait and see what else they can do with regard to medication and situations like that. But people who have had those types of issues before have received some comfort by receiving PEMF treatments to help take inflammation out of the area, to let the nerve better be in a position to heal itself and to provide some comfort to the client itself. You could also, again, take the aspect that if you're wanting to treat their shoulders, for example, let's say you treat their upper shoulders and the back of their neck, and what you're going to do is improve the blood flow to the body, improve the overall blood oxygenation of the body. It allows the body, as you know, to better utilize the oxygen that's there. The cells can better utilize the oxygen that's available to them, which then is going to circulate through the body, which may be of benefit to this type of facial nerve type situation that people also often experience. So a lot of good questions out there. If you have any questions and you want to talk with me, it's 502-599-9722, and I'd be happy to give you a call back and we can visit. Let's see, I want to make sure I didn't miss something. Small dog, 13, this not just about horses, small dog, 13 pounds, has been diagnosed with liver disease. Well, again, if they're having a liver disease or a liver type situation, whatever it may be, any organ in the body needs good blood flow. Any organ in the body needs cellular health in order to better heal itself. And all we're doing is allowing the body to be in a position to better deal with and potentially heal itself. So again, on a small animal like that, 13-pound dog, is that what it was? 13-pound dog. Treat the dog. You're not doing anything. Again, clear it with the vet, tell the vet what you're doing, or ask the vet that you've been asked to do this, and make sure that you clear that. But to help the blood flow and the blood oxygenation could certainly make the dog more comfortable and allow it to better deal with its healing processes totally on its own, better position to better heal itself. Okay, let's see here if there's anything else. Any specific recommendations for treatment of a horse with a fracture in the tarsal of his hock? Fracture is located on the inside of the bone. Well, the modality, the PEMF modality, as you know, is FDA cleared, FDA approved for non-union bone fractures, and it's been very beneficial to help speed the healing of bone injuries and fractures in people and animals and so forth. So in this situation, you'd certainly want to treat the hock area, potentially with the butterfly, or use the large loop and put it over the hock and treat for 5 to 10 minutes at a very moderate setting. You don't want to induce any additional pain, but just treat it in a moderate, comfortable setting. You'll be able to tell. You watch the horse's eyes and you'll see if it's not comfortable. But I just, as Aaron always says, what's the best guideline for doing something? Put it on and treat. And I would, if it's a fracture like this, I would treat as often as possible. Certainly 2 or 3 times a week if the location allows and the client allows for that to happen. But I would treat that area in that fashion. To also do a full body treatment, perhaps once a week, to get overall good blood oxygenation and flow through the body will help that situation improve as well. So that'd be my thoughts on a hock situation like that. Okay, horse TBI, traumatic brain injury update from last week. First session, horse grew agitated and was elevated to aggressive. Post session, couldn't use his hind quarters. About 10 minutes post session, he was back to normal. Chiropractor yesterday. PEMF again this AM at a very low setting. Have been told my doctor that the TBI often becomes agitated and even more violent during various therapies. Any other suggestions? Patience is a suggestion. Treat the area, treat it very low. Again, if you're treating the brain area, what you might want to do is come back and treat the overall body, so the good blood flow and good oxygenation will work through the neck and brain area and can potentially provide benefit to the comfort and to the healing process of that type of situation. When we do stroke patients and doctors have referred stroke folks to us, or people with depression, to receive these types of treatments, very low settings are always administered so they can get the energy that we want, but it's not something that's causing additional agitation or anything like that. So that's how I would approach it. You don't have to necessarily be right on the area of the injury to provide some nourishment and health to it. So I would simply look at treating the neck and the upper body, so that again that good blood flow can move to the area of the injury that you're dealing with, and look for the results that you're getting. As time goes on, as things begin to heal and the brain injury improves, then you can maybe go closer, put the coils closer to the head, on the head, and treat it like that. We are in the midst of a study at the University of Colorado with being led by Dr. Larry Lyons from California, dealing with concussive injuries to the brain. And so what they're doing is they're doing a brain test, a brain scan, to determine the condition or the age of the brain post-injury, and then they're treating over a 5-week period of time and coming back and doing another test, a brain age test, to see how the recovery process is going. So we hope to learn a lot from that and be able to hand that over or move that over to the TBI types of situations for the overall healing process. So you always want to, again, work with the doctors, make sure that they're aware of what you're doing, and follow their direction with the various indications. If they're not aware of what's going on, my recommendation is call us, and if they want to talk with us and have us give them some background, if they want some information, certainly it's available on the website, or they can go to the AOPP, Association of PEMF Professionals, and do search and find answers and see how this particular therapy has been used in their situations in the past. So some docs are up on what we're doing and follow it and understand it and will work with you on it. Others haven't got the information that they need yet, or they haven't expanded their horizons on what other therapies may be available to them, and we're certainly here to help discuss that with people if they want to discuss it. To that end, we'll talk about Parkinson's in a few minutes, something that's going on there. In one of your videos, it sounded like you mentioned one should not butterfly twist the large loop. I wanted to get clarification on what not to do with the attachments in terms of manipulating them. Well, yes, you can take it's possible to take the large loop, twist it around a figure 8, and turn it into a butterfly type of attachment. The manufacturers have always maintained not to do that because you are basically rubbing those wires together and could cause the loop to wear out more quickly. And so that's the reason that it's not recommended to do that. People do it. I'm probably one of the worst people at that. I've done it that way my entire career with PEMF. I will bind that down, but it can cause the loop to wear out quicker, or and therefore have to replace the loop at some point in time. So that's the reason that you don't do it, is you don't want to cause your attachments to wear out. They're not cheap, and so you want to watch that. But you can do that. Just understand that it can cause it to wear more rapidly. Hope that helps. Very excited to hear about a traumatic brain injury study. Yes, we're excited about that as well. Can you comment on the recent treatment eye doctors are using PEMF therapy on eye disorders? Well, there are docs that are working with that and doing that, and basically what we're doing is the basis of the device is to improve circulation, improve oxygenation to those areas. So if you were to treat like this, it would help the eyeballs and the circulation and what goes on there. And some doctors are experimenting with that, because so many things when you deal with issues are inflammation related, and they do need improved blood flow. Is this something that's going to totally reverse something? No, but it is something that can aid the body in helping it heal itself, or heal in conjunction with what the doctors are doing. Again, that's always a situation that you want to clear with your doctor that you work with. But folks are doing that. They're also using it, if you're going to go up there, they're putting coils to their ears to have some hope and help with tinnitus, the ringing that people have in their ears, the tinnitus type of situation, maybe in conjunction with the medication that they're particularly using, can help, again, the blood flow to the area, and hopefully that will help things come along and not be as much of a problem as people may have. All right, let's see. Any other questions? Let me go over here to Castbox and see if there's anything there. Rumi's there. Hello, Rumi. How are you? Jasmine, good morning. Thank you for being with us this morning. If you have any questions, put them in the chat box there on Castbox, and I'd be happy to have a look at them and answer them for you. And if you have another question for me on Facebook, simply put it in the chat box, and I'd be happy to have a look at it. Let's see. Okay, it said there was a new comment. Thought might be a question there. Let's go back over here, see if we have a question. Okay, no other questions at this point. If you'd like to visit with me, send me a text, 502-599-9722. I'd be happy to give you a ring back and we can visit. If you call, you'll be entered in the drawing to win a gift box, a gift basket of MagnaWave gear. One caller will receive that. And if you have 4 or 5 callers, then there's 4 or 5 people that are going to be in the drawing. But we'd love to visit with you and talk with you if you have questions that we can answer for you. We'll stay for a few minutes. If you have questions, please give a question and we'll take care of it. What's everyone's favorite way of transporting their attachments? Well, we're working on that, but people use various things. Some people use a rope bag like ropers use, because they're round and they can put a lot in them. Others have various duffels. We have some different duffels that we supply that people have used and liked in order to be able to put their attachments in. It's pretty much a personal thing. What's easiest for you to handle. Some people use a larger backpack that they can just throw over their shoulder and transport them in that fashion. Has anyone treated a dog with mammary gland cancer? Well, certainly that's a question that we would approach with Dr. Marty if he were available this morning, but people do use, Marty uses the device for dogs that have experienced cancer. They use the device for tumors at Hope for Cancer because it helps reduce the tumors and take the inflammation out, provides additional oxygenation. Cancer doesn't like oxygen. Oxygen has a tendency, it does attack the cancer cells and helps, in many cases, control, kill, or whatever. And so there are various protocols that people are using today, certainly chemo. A lot of people are using intravenous vitamin C therapy and other types of things that they're doing to attack these cancer cells and these tumors. But there have been plenty of anecdotal testimonials that are available on the website, how people have used this particular therapy and have had a reduction in tumor size, which makes it in many cases more easily surgically removed or dealt with in other ways. So again, that's something that you want to talk about with the veterinarian in this with this dog and see what they feel about various treatments. If you have a specific question that needs to be answered, give us a call. We can check with the doctors that we work with Dr. Marty and other folks to get some answers that you're looking for that may be beneficial to the health and well-being of these animals. Okay, let's see. What is the best location to treat for an aged horse with chronic cough and respiratory issues? Well, you certainly want to treat the lungs, the chest area, treat the lungs, the upper lungs and the lower lungs on the animal, treat the esophagus so there's good airway opening so the horse can breathe properly. If they're using a nebulizer to get some medication into the lungs, then you can treat it after or before or sometimes at the same time to help that medication be absorbed and get the uptake improved into the blood flow into the lungs that can help the process along. But certainly you want to treat the area of the lungs and the neck esophagus of the animal to get good blood flow, good oxygenation to the area, which could be potentially beneficial to the health and well-being of the animal. Great question, Barbara. Thank you. Any other questions, folks? Just simply put them in the Facebook chat, YouTube, or text me, 502-599-9722, and I will give you a call back, and we can visit. Let's see here. Real quick check. Any other questions? Okay. No other questions? Let's see here. Oh, I was going to talk about Parkinson's. We're going to reach out. We attended the Muhammad Ali Awards banquet here in Louisville a couple of weeks ago, and the Michael J. Fox Foundation. Michael received an award for his work with Parkinson's. He was unable to attend, but his president and who runs his organization, the lady who handles that for him, was there, received the presentation, spoke for a few minutes about the foundation in Parkinson's, and we have had a lot of people that have received good results who have Parkinson's and use the PEMF device, use MagnaWave to give them some comfort, and in many cases minimizes the symptoms that they're experiencing, allowing them to lead a more normal life. In one case, in several cases, they're able to reduce their medications that they take. They take a lot of pills and a lot of medication for Parkinson's, and some people are down now to where only taking one or two of the medications, have returned to work, and can be happier and lead a more productive life. And so what we're going to do is I'm reaching out this week to the Michael J. Fox Foundation to work with them so they can do some trials with the device to see what it can do and how it can work, and potentially see it developed and used more often in those types of situations. So I'm excited about doing that. I'm going to reach out, like I said, going to reach out to them and hopefully get down the road there to help some people, or at least see how much more we can help people that are experiencing those types of issues with Parkinson's. Question, will PEMF break up scar tissue? Sounds like an elementary question, I know, but just have someone adamant that it doesn't. It does. If it's used post-surgery, it can reduce the amount of scarring that will occur. It can allow the wound or the surgery to heal in a more aligned fashion and keep scarring at a minimum. It will not necessarily remove scarring. We've had situations with competition horses and with people to where you have scarring, and what it can do is it can make the tissue a bit more pliable. It can take some of the stiffness and the clumpiness out of the scar tissue if the scarring is harming the mobility of the body or the ankle or the knee, wherever it may be. And we've experienced situations to where we have this. I had a racehorse at one point. We've got a couple of texts here, so we're going to make some calls. I had a racehorse at one point that had scarring on its ankle, and it was beginning to impede how the horse would perform. Well, we treated it consistently for a couple of weeks, and the glob of scarring became much more pliable, and the horse was able to function normally. Did we eliminate the scarring? No, but it just made it more pliable. So the secret to scarring is after the surgery or after the injury to help it heal with less scarring. Okay, let's see here. Do we have a question, Chris?
No.
Okay, let me go here. Terry's got a question. Here we go. Dial it up. Two ringing in. Hello. Come on. Well, she said she was available. Something must have come up. Oh, Terry.
Hello.
Hello.
Hi, Pat.
How are you?
I'm good. How are you doing?
Good. Sounds like you're doing a treatment on somebody.
I am. I'm sitting here. I'm watching you, and I've got my feet inside the large loop, which is something my daughter and I do every day.
There you go.
Yep.
Great.
Yep. I'm multitasking this morning. But
there you go.
Hey, I have a question, and this is something I feel like maybe Elaine let it slip a little bit, maybe at MagnaCon, or somebody had mentioned it, and then I haven't heard anything since. But wondering about MagnaWave as therapy, like anti-aging therapy, maybe skin treatment, something like that. I mean, it makes sense with, increased oxygenation and blood flow and all of that obviously is going to be helpful. But I thought she said something about maybe we'd see some kind of a flexible facial mat or something like that. Did I dream that?
You did not dream that. You did not dream that. We are working on 2 or 3 different designs. Flexibility is the key. And then we want it to be so it can be easily cleaned. So we're looking at the fabric to use to have good flexibility, good cleaning properties, that type of thing, to where you could place it basically over the face or the area of shoulder that you're working on, whatever it may be, to flex to the area. So we thought it would be very easy, just here, let's just do it this way and do it, but it wasn't flexible enough or it wasn't comfortable enough. So we are working with that to have that type of attachment available. With that said, we know that, certainly the large loop, kind of like you're using the large loop now for your feet, the reflexology aspect, you can hold the large loop up to the face and not have to touch the face at all. And that's another question. Some people, from one person to another, again, the cleaning properties, whereas the large loop will do whatever we want to do. And a little quick story on that, going back 10 or 12 years, when we were on the road a lot, and we talked about it and we learned about this at an anti-aging conference. That's where we actually were introduced to the particular device that we ended up taking to the marketplace. But what my wife would do is she would use an oral hyaluronic acid, a liquid oral hyaluronic acid, and she'd put it on her face, and then she would hold the large loop up there to help the absorption of that particular product, which did diminish wrinkles, made the skin smoother and a little more full, if you will. I don't want to say plumpy, but just a little more full. And we didn't think that much of it, but she was doing it, and we went home to our hometown over Christmas, and everybody thought she had had work done. And
wow.
And so it was pretty exciting, and she still does that today. Not as regular, but she does do that today, and we've had folks that have utilized that. And again, and you could do that with any type of cream. Hyaluronic acid, there's Neutrogena and different products that have HA in them, in a cream that people will put on their face or their hands or whatever, and then use something to enhance the absorption and help the topical be put into the body. We do know that whether it's on the face, hands, elbows, knees, whatever it may be, if you put a topical dressing on, you can use the PEMF, the pulsing of the PEMF, to help infuse that topical treatment into the system that you're working on. So yeah, it's pretty interesting, but we are working on that.
That is. Yeah, that's exciting. I would think that would work with like you said, pretty much any skincare products or any topical.
Absolutely,
You know,
yes.
so.
There are doctors. Older folks get a situation where their skin gets very thin and kind of slips. They call that skin slip, where it opens up and breaks. Doctors have done the same thing. They'll use an ointment on the hand, and then they'll use the machine to press and help that get in there to, again, help make the skin healthier, so these people don't have that type of situation. So there's just a lot of things that work very well in concert together.
Mm-hmm. Well, I'm going to add that too. Now, my feet in the large loop every day, and my face in the large loop every day.
There you go.
Add that to my treatment
There you
protocol
go.
here.
There you go. Thanks for the call.
Thanks, Pat.
Bye-bye. Okay, let's see. Driving to a client appointment. We'll lose cell service very soon. I will catch you next time. Okay. Sorry that we're unable to do that. Let's try another one here. (1963). That was a good year, 1963. I was a kid back in 1963. Biohacker.
Hello?
Hello,
Hello?
this is Pat Ziemer.
Hi, Pat. Thanks for the call.
Yes, ma'am. You're
Well,
talk to me.
okay. You had mentioned last week or the week before about starting a group of people that are biohackers.
Yes.
That want to be involved in that aspect of whatever it is you're doing.
Okay.
And I just wanted to share with you what I'm doing and see if you'd ever heard of it before.
Okay.
I'm involved with a biotech company called LifeVantage, and they own the patents on an NRF2 activator called Protandem. Have you heard of it?
I have.
Okay.
And I've had people who have used those products in association with our form of therapy as a complementary procedure, and to very good success.
Yes, I'm having wonderful success with it. So I just wanted to let you guys know that I wanted to participate in that, and that I'm having great success.
Good.
And I look forward to whatever it is that you're developing in that arena.
Yes, in fact, I was working on that a little bit this morning when I was up early, and hoping to kick that off as a radio program in the next 2 weeks. So I'll be in touch, and we'll visit.
Okay, that sounds great. Thank you so much, and I really enjoy your Tuesday morning office hours. I always learn something new, and I appreciate the answers that you give me. Thank you so much.
Good deal. Thank you so much. Have a great day.
You too.
Bye-bye. Okay. There are a lot of various complementary. Pardon me?
Don't forget to tell them to email in.
Oh, yeah. If you've called me, email in support@MagnaWavePEMF.com, and we will enter you in the. There are 4 people today that are in line to get the gift box, but you need to send an email to support@MagnaWavePEMF.com, and the person who didn't give me a name but's driving into a dead space, you sent me a text, so send the email, and we'll see what we can do. Any other questions, let me know. I'll be happy to answer them. Let me take a look here, see if we've got anything else. Yes, there are a couple. Horse ruptured a peripheral nerve last night, couldn't be sutured, just stitched the skin back over and left drain. Oh, this is from Lee. Left to drain in. Low level treatment over the area. At what point when the drain is out? I would say as soon as they remove the drain, Lee, you could begin treatments, because they're pretty confident that everything is buttoned up the way it should be, and there's no active bleeding or that type of situation. So I would say when the drain's removed, if they take the pressure bandage off later in the week, and if they're happy with that, then you would go begin the treatment at that point to speed the healing and help the healing process along. Let's see, next question. I'm curious to whether you've had any experience using the MagnaWave to assist in burn treatment or skin grafting. I don't know about skin grafting, but again, the graft needs to be accepted by the body. Again, this is a question for the doc. However, now talking about a burn, I have had situations where people have burned their hand or had a burn, and you treat and you improve the blood flow to the area, and the oxygen to the area helps relieve, add to the pain relief that you're looking for. Hydrowave water over a burn with the silver, the nano-sized particles of silver. Colloidal silver was first used and still is used with burn patients to help the healing process and the pain relief process with burns. And so certainly to use this device with someone that's had a burn could potentially help the pain that they're experiencing and help get to a point to where they're healing in a happier, faster type of manner. Hope that helps, but certainly again, you want to check with your doc. Can you please speak about the others attachments and how to be used? Oh, wait a minute. What's this? Try to text to. Oh, send the text. That's the. Never mind. I was trying to read the number. Can you please speak about other attachments and how to be used? Well, most of the devices come with two attachments, the large loop and the butterfly loop. And you know that the butterfly loop can be opened up and put over a joint, can be put over a shoulder, over a knee, can be opened up and put on the back. You can do about whatever you want. It can also be left closed, which increases the intensity a little bit to, again, treat a knee, treat a specific area on the back. That type of thing, because you're doing a smaller area. The large loop, again, can be put over the shoulder, can be placed over the lungs, over the back, low back, wherever you might want it. The difference between those two, I had a gentleman this weekend that we were treating at the retired Racehorse project who has a lot of low back pain, and it was very interesting. The gentleman came up and said, I've got low back pain, treat me. Well, we treated him for 10 minutes. He got up, well, I got a little bit of relief. We sat him back down, treated him for another 10 minutes, changed the loop configuration a little bit. He got up and said, oh my God, this is better than I've felt in years. And took a machine home with him from this event to use, because he's got that serious of a situation with him. Now, but what we did notice is that we used the large loop on him. It stimulated a larger area of muscle and tissue, and he was uncomfortable with that. When we put the smaller loop, the butterfly loop, directly over the area of his pain, we were able to increase the intensity and work that area without stimulating area that made it uncomfortable. So that's how you learn to use the individual loops differently. And then certainly there's the mat that you can put behind you and treat your whole back with the mat, or you can lay on it on your hips or whatever. If you want to treat your hips, you can lay your hips on the mat or sit on the mat in that fashion to utilize the mat. And then certainly we have the paddle, which is smaller, looks like a ping pong paddle that we use. It comes out more like a spotlight, if you will. It's a more intense, stronger type of signal that you can use to very much pinpoint where you want to be. For years, we had just the two attachments, and they will do anything that you need to do. As we refine the attachments, people find that I like this one a little better, or I like using that one. It really becomes a matter of personal preference. Once you have used this device several times, the number I use to train someone, once you've done 50 treatments, whether it's on small animals, people, or horses, once you've treated 50 different things or 50 different clients, you're going to see, I like this attachment for this, I like this attachment for that, and be able to work them in. And people, I'm telling you, people have come up with some configurations on these large butterfly wings, how they use them, how they put them in place, that are amazing. And I look at them and I think, wow, how did they think of doing that? But they're getting the result that they're looking for, and so they just experiment. And then they share that with us. We put it on in the Facebook group, and other people can take those tips and better take care and service their clients that they're needing to do. But the two basic attachments will do everything. But then again, there's the paddle, the hoof box, the large wave wings, and the mats that we're working on. Now we have the vibration mat, which provides vibration to the body, kind of like a massage at various frequency levels for relaxation and various features that are available for depression and just attention and all that type of stuff, with PEMF being delivered at the same time as the vibration, and people are really enjoying that full body experience that we can get with the vibration mat. So just that's how they might be used. We can go specific, watch some of the videos. We cover a lot of different attachments in the various videos and how they are applied and utilized. So that could be a good way for you to learn something there. I've got a couple more people who want to talk. Let's see if there's anyone here who would like more about the biotech concept. Just message. Okay, that's good. Let's see. Can you other attachments? All right. Let's make a call. Dial it up. This is Ashley has a question for us.
Hello, this is Ashley.
Hi, Ashley. Pat Ziemer here.
How are you today?
I'm good. You have a question for me?
I do. I have a neighbor who has a child. He's an infant, 7 months old possibly, and he has a staph infection covering his entire body.
Well,
And there's... Okay.
you're breaking up a little bit.
Okay, can you hear me now?
I can.
Okay. She has an infant that's 7 months old, and he has a staph infection covering his entire body.
Okay.
And
if there's been any testimonials of people using the MagnaWave to treat staph infections, more specifically on infants.
I can't say for a fact that there's been anyone talk about treating infants with a staph infection. Certainly you want to deal with the doc and how the circulation can be improved and enhanced on an infant. There are people in the Amish community that they do things a little different in the Amish community, and they have treated infants for a number of various indications and working with the docs or whatever, and so as a rule we would certainly recommend that if you're treating an infant that you talk with the doctor and understand exactly what's going on and what they're doing. I would go to the AOPP and in the search bar put infant staph infection PEMF, and you might find some things that pop up there that will address that more specifically.
Okay.
Okay.
Perfect. I'll do that. And then also, I have been treating an individual with Parkinson's. I spoke with Miss Karen Ainsworth, and she filled me in a lot on how to treat him. And in 2 treatments, he is like already life-changing. He says we treat the back of his neck, basically the back of his head, the lower cervical area for about 6 minutes on a pretty low setting. I have a Julian machine, so it's variable as far as the intensity. And then we treat the top of his head for another 5 minutes, and then he lays on my mat. I just have a regular mat, and we lay him on that for 10 to 12 minutes, and then we treat his feet.
Okay.
And it's completely reduced his muscle stiffness. He's thinking more clearly. In the first treatment, his speech improved over, the course of the first 15 minutes. And his tremors have definitely lessened. He's probably not as severe a case as Karen's husband. As far as she was telling me, he was taking 9 medications and reduced down to 5, where this gentleman is only taking 2. But I saw some people asking about that, and that's how we've been treating him, and with a lot of success. He's already ready for 10 more sessions of it. So
that's wonderful.
It's definitely been a benefit for this gentleman.
That's great. Thank you so much for sharing that.
You're welcome. And also, I saw another gal asked about burns. and I sent her a message. We treated my year-old who burned her hand with the MagnaWave, and in 2 weeks she was fully healed. I never got her any sort of topical medication. Speaking of her, we just treated her for 10 to 15 minutes twice a day on her hand that was burned, and
Great.
she was using it. Using it full potential, no issues. That wasn't acting like it was painful with those sessions.
That's wonderful. Thank you so much for sharing.
Thank you.
Send us an email, support@MagnaWave PEMF, to be eligible for the gift basket.
Yes, sir.
Thank
yes,
you.
sir. Thank you.
Bye-bye. Great sharing, great testimonial there. How they're using it to relieve some of the symptoms of Parkinson's, just to provide comfort, certainly in conjunction with the other things that they're doing with the docs, I'm sure. Okay, let's see here. Let me go to this area. Another call. Moving along. Oh my, we're over time today, aren't we? So we'll do another call, and then we'll say good day, because we got other stuff we need to do. It's amazing how time flies when you're having fun.
Hello.
Hello, Pat Ziemer here, Amanda. How are you?
Yes. All right. How are you?
I'm good. Do you have a question for me?
Yeah. I've been treating a lady with Parkinson's,
Mm-hmm.
and then she's been doing fairly well. I've been doing twice a week, but yesterday she had a bad day, and I haven't got to talk to her much. Except for she wasn't able. I do massages plus MagnaWave.
Uh-huh.
And the tremors is what. Is there just a certain amount of time exactly amount of time to work on her?
No, each person is different. The severity of their tremors and what they're experiencing and the medications they're on. That's why it's important to work as closely with the doc as possible.
Right.
But certainly, if she's seeing some improvement with her quality of life and a reduction of tremors, as the previous caller just talked about, they treated the top of the head, the lower area of the neck, and then they lay on the mat and treat the feet. So there's kind of a little system there that they run through with that particular person that she's dealing with, and you might want to kind of think that through. If you have specific questions you want to talk further, I'd call the office and talk to Erin, and she can kind of walk you through what some folks have done. And to that end, and I appreciate your calling, but to that end, and this is to you and anyone else that is working with folks with Parkinson's, if you'd be so kind as to send us an email or send us some information through Facebook or wherever, through Messenger, as to what you're doing and the kind of result that you're seeing, because I will compile that information, and when I approach the Michael J. Fox Foundation, to show them a list of testimonials that people are experiencing. So I would really ask you, those of you who are listening and watching with us today, to do that. Send us some emails or information through Facebook so we can then compile that and share that with the foundation. I appreciate you and you talk about lupus. Certainly there's a lot of different ways to approach that, but to look for comfort and to treat comfortably would be the initial thing that you want to do.
The initial?
Yeah.
So what, will MagnaWave flare it up before it gets better? Like they would notice a difference, or do you think that it'd be that they would notice a difference from the very beginning?
Well, I mean, when you're talking about various tumor growths and things like that, you're not, comfort-wise, they may experience some comfort and pain relief quickly. But in terms of everything else, each person's system is different, and the medications that they're on, and we've had people that have had dramatic reductions in tumor counts and so forth. But again, they've worked closely with supervision, and there's a lot of testimonials. Go to the MagnaWave research page, testimonials, and search there, and there's just amazing testimonials from folks on what they've done and how they've utilized MagnaWave for that.
And also cancer. Is there a video or anything? There was a guy that I've been working with that we didn't know that at the very beginning I've been doing massages, and then we started doing MagnaWave. Then he found out that he had a rare type of cancer, and his levels have been exactly the same, and they haven't changed any since we've been doing the MagnaWave. So I'm like, well, the oxygen, like you said earlier, and I'm like going, he's like, is there any information that I can get to read on this to be able to
I would look at Hope for Cancer.
Okay.
They're in Tijuana, and they use MagnaWave and PEMF as part of their daily regimen with their clients and patients. And they may have some stuff on their website. And then I'd certainly search AOPP, PMFprofessionals.com, and you may find some information there that people have shared with regard to testimonials on how they've utilized PEMF for the various indications.
Okay.
Okay, doke.
All right. Thank you.
Okay, send an email to support at MagnaWave PEMF and be entered for the prize today.
All right. Thank you.
Thanks for calling. Bye-bye. Okay, let's see. Okay. Actually, we've got all those. One last thing here. Oh, someone had posted not using PEMF or massage during colder weather. Wouldn't it be important in cold weather to treat and help overall blood flow and cellular health? I have never had a situation in my personal treating regimens over the years where I did not treat in cold weather. There were days I didn't want to treat because I was freezing, or maybe didn't treat because I was so cold you didn't want to go outside. But to improve the blood flow of the body, massage is something that I'm not familiar with. If they say don't massage, if the massage classes get into that, then that's certainly a directive from the massage aspect of things. But over the years, in colder temperatures and colder weather, we have certainly treated in a barn atmosphere and have not seen any reasons not to do it, to avoid it in those types of situations. I've not experienced that. Again, someone may have a specific reason that something's going on in the cold and they don't want to treat it. That could be, and again, that could be a doctor or a veterinarian type of question to approach. But I've never experienced anything like that. We have treated in all types of weather conditions, storming and cold and heat, and it's just amazing. So yeah, that's something to look. And this is the last one because we really are out of time. Went out to treat the horse, and he had a 2-day-old puncture. Did a whole body for 20 minutes and 10 minutes with the paddle over the cut. Swelling went away immediately. I would think that it might. Was out the following day and did another 10-minute just on the cut since I was there, even though it looked good. The next afternoon, his leg was huge and sensitive. I did 15 to 10 minutes with a small butterfly and 5 with the paddle. Didn't see the horse yesterday, but the owner said it was still huge. Well, when they have an injury that's going to go there, when you're treating, if it's gonna inflame, it's gonna swell. It's gonna do that. Now, can we work to control that and help bring it down? Yes. If it is persisting for 2 or 3 days, there's something else going on. There's something else in that area, and certainly the veterinarian needs to be in place. I always do that. If I treat an animal today and tomorrow it's not any better, and we treat it again hoping that it will be better, and it's still not any better, and then we treat it a third day and it's still not any better, it's time to call the doc, if they haven't already called the doc. And that's kind of how we play it at that point. This is a type of treatment that supplies energy to the body, and if the body can utilize that to help itself immediately, it will do that. If there's something else going on causing the problem to be exacerbated, it's going to exacerbate the problem, and you need to talk, certainly take it to the next level and talk with the doc. That would be my recommendation and thought there. Great question, and need to always take a look at that. I hope it's been helpful today. I've always enjoyed being here. It's been we started a little late, but we've gone full circle this morning. So I want to thank you for being with me, and we look forward to seeing you again next Tuesday. And we enjoy being here. Thanks so much for joining me. Have a great day. Bye.